You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Cathy Biase.
Everyone, and welcome to the Health Hub. I'm Cathy Biase, your host, and along with our producer, Alex Diaz, we would like to welcome you to our show this morning. Good morning, Alex.
Good morning, Cathy. How are you?
I'm well. How are you doing?
Pretty good, pretty good.
That's good.
I had a bit of early morning, but I'm glad I'm here.
Yeah, it was a bit of an early morning, too, fighting the traffic, but that's okay. It's all good. It's a beautiful sunny day, so awesome. Our show today is taped, so unfortunately no opportunity for call-in. But please do follow us on Instagram, Twitter, and Facebook. Our handle is at the Health Hub RMC. If there are questions unanswered from the show today, or you would like to be able to contact our guests, you can email us at thh@radiomaria.ca. Also, if you have any show interests that you'd like us to pursue, please feel free to pass those along. We do our best to try and get the greatest guests and content to you, so never be shy of letting us know what you'd like to hear on the show. Also, all of our shows are flipped over into podcast format. It's called The Health Hub on iTunes, SoundCloud, all of your favorite podcast platforms. You can also find our podcasts on the Radio Maria Canada website, which is www.radiomaria.ca, and on my website, cathybiase.com. And if you like what you hear, please feel free to leave us a nice comment. So, Alex, I'm going to talk a bit about smoothies. Do you ever partake in smoothies?
I haven't actually started doing that, but that's something that I would like to.
You would like to do?
I would like to do that for sure.
I don't do them on a daily basis. I'm really lazy. I'm quite lazy, but I do have them a couple of times a week. But
it's just lately I've been trying to be a bit more health conscious, so it's just a matter of trying to find the time to prepare it and
get it going and all that.
Exactly. And
well, there are some actually I've seen in the grocery store, they're now selling smoothie packages. So they've got all of the ingredients. One type is in a puck form, so they're frozen, and all you do is throw them in your blender and you add your liquid. But you can do that at home on your own. Mm-hmm. So, you get a Ziploc bag and you just throw all the ingredients you want in there and stick them into the freezer and throw them into your blender and you're done. So there are tricks to the trade. For me, I like smoothies every now and again. I like to chew my food, so that's one of the drawbacks I have, although I do recommend them a lot for people, especially if you're trying to get, your digestive tract back on par, or you're having some issues and you want, something that's very easily digested. I do love smoothies, and there are endless varieties of things that you can have. I always tell people to have a smoothie journal, because
that really helps carry on.
It will, because there are some that you'll find are delicious, and some that, may not float your boat. I prefer the ones that are more fruit-based and water-based. Mm-hmm. I don't like the thick, creamy ones.
Okay.
And that's my personal preference. But so keeping a journal of the different ingredients, but it really is a kitchen sink of throwing in just some amazing ingredients, and it really is great to start your morning off that way.
Yes, so, especially when you've figured out the flavors that you really enjoy,
yes.
And that way you're able to look forward to drinking your smoothie, and then it's not so much of
it's not a
chore at that point,
right?
A
lot of this stuff is habit, and I always say that I profess things, and I really have to do a lot of them. I do eat well, and I do incorporate a lot of things, but smoothies are one thing that I would really like. And you don't just have to have them for breakfast.
Oh, that's
you
true.
can have them throughout the day, so it's not a big
And it
thing.
helps when you've got a busy schedule in the middle of the day if you need something quick.
It really does.
Yep.
It really does. I have a great protein powder that I like just the flavor of, so I use that, and sometimes I'll make it into a smoothie, but a lot of times I just use the protein powder and then either coconut milk or coconut water, or regular water. But a common mistake that I see with people is loading up your blender. So I wanted to go over with everybody the proper order that you should load your blender, because if you load it incorrectly, the blade may have some issues with actually blending things well, and you'll find that you're shaking the blender, poking it, and trying to get things moving. So, once you've locked and loaded your blender with everything, you want this just to hit the button and go, and a smooth entrance into Smoothie Land. But there is a way to do it. So basically what you're doing is you're going from soft to hard. So you're putting in your liquids first, your yogurts, whatever, if you're doing an almond milk or regular water, you put that in first. And then on top of that, you're going to add your small frozen fruits like your berries, your strawberries, your blueberries. Strawberries would definitely be cut up, and this is what would make them small. If you're adding whole strawberries and you're not going to cut them up, they would go third. So the big guns sort of it goes the water, the liquid, the small, and then the big. And then on top of that, you're going to add your ice. And that just allows it to blend nicely, and you get that nice suction in of the blade, and everything blends smoothly, and you're not stopping and poking and moving things around. So it, you're trying to get out the door. You've done all your stuff to get your great smoothie on the go. So load it properly, and life will be really simple for you. And just a few things that you can add to your smoothie, as well as your fruits and your liquids and your spinach or kale or whatever you're doing. Throw in some nuts. You can throw in some almond butter. You can throw in chia seed, hemp seed. All of these things are just taking your nutrition to the next level. So just a quick thing to start your day off with, or you can use it as a snack, whatever, as a meal replacement. But just thought I'd let you know about that. I do see people frustrated come into me and saying my blender doesn't work, and sometimes it's not the blender.
It's the process of how you do it.
The way you load it. So
exactly, yeah.
You don't necessarily need to go buy the top of the line blender. Just loading it properly may solve a lot of your problems. So there you go.
Oh, thanks, Cathy.
Hit the go button and you'll be happy.
Just put the lid on top. Just
put
make
the
sure.
lid on top. I have done that once. I have done that once. But anyway, put the lid on top, hit go, and your smoothie will turn out great. So on to our show today. This is something that's of real interest to me, and it came, the idea for the show actually came from a previous show that we had with saunas and detoxification, and the topic of preconception care came up in that podcast, and I thought, what a great topic. It's not something that I ever really actively pursued when I had my children. I don't even know if it was a thing, 28 years ago, but it certainly is now. And our guest today is Dr. Rebecca Genuis, and she was born and raised in Burlington, Ontario. So she's a homegrown talent. She attended McMaster University, obtaining her Bachelor of Health Sciences. She went on to attend the Michael DeGroote School of Medicine and obtained her medical degree. And during this 3-year program, she was at a medical conference and heard a physician speak of his practice on environmental medicine. She became fascinated with the new scientific information being translated into clinical practice to target the root causes of disease. Dr. Genuis found that she enjoyed caring for women throughout their reproductive years while continuing to be fascinated by the field of environmental medicine. Given the rising rates of numerous childhood illnesses, Dr. Genuis decided to begin her work in preconception care, helping women to prepare their bodies for pregnancy and to help women have healthy, happy pregnancies and prevent adverse health outcomes in children. Dr. Rebecca Genuis has written for several medical journals on topics ranging from preconception care, nutrition, and environmental health to medical ethics. She is a mother of 3 children, and having seen the benefits of healthy living in her children, she is passionate about educating women to make healthy choices for themselves and their families. Dr. Genuis currently lives in Alberta, Canada, and raising her family there. Our learning points today will be: what is preconception care? Why is preconception care important? And is preconception health important for men as well as women? We'll be back after a few minutes.
Your baby blues, so full of wonder. Your curly cues, your contagious smile. Storybooks are full of fairy tales of kings and queens and the bluest skies. But my heart is torn just in knowing you'll someday see the truth from lies. When the clouds will rage and storms will race in, but you will be safe in my arms. Rains will pour down, waves will crash around, but you will be safe in my arms. Castles they might crumble, dreams may not come true, but you are never on alone, 'cause I will always love you.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Cathy Biase.
Welcome back, everybody. Our show is taped today, so no opportunity to call in, but feel free again to follow us on Twitter, Facebook, and Instagram at the Health Hub RMC. So welcome to the show, Dr. Genuis. How are you this morning?
I'm great. Thanks for having me. It's a pleasure to be with you.
Thank you for joining us. I know the time difference makes this a little bit early for you, so we really do appreciate your time and having young children. I know that sleep can be a bit of an issue, but we do appreciate having you here.
Absolutely. I think it's such an important cause, so I'm glad that you're speaking about it with your listeners today.
Well, it really is. And like I said, when I was having my children, I had 4 children, there was really no sort of field of preconception care that I knew about. But it is important. How long have you been practicing in this area?
Well, I started sort of thinking about it and receiving training for it when I was a medical resident, which was sort of 5 to 7 years ago. And then since I graduated, it's pretty much exclusively what I've done. So that's been for the last 4.5 years.
And do you had this passion for environmental medicine, and now are these 2 separate entities, or do you find that they are very much integrated in your practice?
Absolutely. So environmental medicine, sometimes people call it functional medicine. They're quite similar, but it's just applying principles about underlying causes of disease to the treatment of it. And so what I seek to do in preconception care is to actually apply those principles before illness has developed in order to prevent it. So it very much is an application of that kind of medicine to healthcare, but more in a preventative measure.
So being in preconception care is sort of new frontier. Environmental medicine is sort of a new frontier. And being a medical doctor and applying both of these things really puts you in a category that is unique amongst your peers, I would imagine.
Yeah, it's a fun place to be. It's exciting. It's challenging at times because I find I spend so much time just sort of poring over new papers as they come out, and as I'm sure you know, the rate is staggering at times, especially about some of this stuff. So it's a challenge. I can't just sit down and read a textbook about it, but it's fascinating, and it certainly keeps me interested in the work that I do.
And having young kids, I'm sure that also is impetus for being on top of this. You're at the perfect age to be educating people on this topic.
Absolutely. And I mean, the importance of it, of course, with my kids then makes it that much more important for me to sort of know and understand and put this stuff into practice. So it's a privilege to be able to share it with patients too and help them and their families.
That's great. Now, for somebody who is thinking of having children, or for someone like me who just doesn't really know exactly what you're talking about, maybe you could give us, a deeper dive into what exactly preconception care is.
Sure. Preconception care, sort of by definition, is the care of women and their partners in the period of time prior to conception, so before they've actually conceived a child. And its goal is to maximize the health of both partners before they conceive, so that they'll then optimize mom's health throughout her pregnancy and the health of her child. So
are you working with both partners at the same time, or are you focusing more on women?
Right. In an ideal world, I would see both partners at every appointment. Often that makes things a bit less practical for couples because I do see them quite often for the period of time I see them. So I generally try and see both partners at least once. And then provided there's no major issues with the male partner, then normally it's the women who are coming back and forth for appointments the rest of the time. And, it kind of works because so many of the changes that I will suggest or the things that we'll do will actually end up being implemented across the family, right? So if we're talking about dietary changes, well, mom generally isn't going to start just cooking healthier meals for herself. She's going to prepare them for both people. If we're talking about supplements, some of them will generalize. If we're talking about air quality, again, things that affecting one person often will affect the whole family. So it's worked pretty well that way so far. And just from a practical point of view, I'm finding it's the easiest way to do it.
Why now is this such an important topic? Is it different? Have times changed? Is it just more knowledge coming out? Or do you find that there is, at this point in history, a real need for people to understand the value of preconception care?
Yeah, so that's a really important question because, you talked about when you were having children and even before that, 40, 50, 60 years ago, I'm not sure that preconception care was as necessary as it is today. But there are things about the day and age that we now find ourselves in that I think make it critical. Here's what's been happening. Over the last few decades, in many respects, we've been seeing our children getting sicker and sicker. Now, sure, if we look at measures like infant mortality, we see that, we've made incredible advances, and that's huge and something that we can and should celebrate. But when we start to look at the incidence of things like, birth defects in infants, things like developmental delays, allergies, asthma, ADHD, autism, some forms of cancer, and so on and so forth, in this area and in many, many subsects, the rates of these things are rising and sometimes at a staggering rate. But, for a long time, we just didn't know what was going on. So even if we saw rates were going up, there wasn't much we could do. If patients asked their doctor why their child developed a food allergy, for instance, and a food allergy that also had never been in that patient's family tree, so it wasn't genetic. But if a child developed that previously and they asked their doctor, why did this happen? How do I prevent my future children from developing food allergies? The honest answer was just that we didn't know. So, avoid the food and best of luck. But fortunately, over the last 10, 20 years, really a lot of research has been coming out that's starting to illuminate the etiology, the underlying cause of many of these problems. And so, the research, it isn't always perfect. We don't always have double-blind randomized controlled trials, but as it continues to be done and to publish and really accumulate, it's starting to become quite clear that there are some things that couples can do that will maximize their chances of having a healthy pregnancy and a healthy child. So, I guess to summarize, the reason why it's important right now is because we have rising rates of illness, and also we know about some things that people can do to really decrease the chance that their child will have one of those concerns.
So is this a focus on, I guess it's a dual focus on mom's health and baby's health?
Yeah, absolutely. Many of us, just from our experience being pregnant, knowing pregnant women, will know that there's such a spectrum in terms of how a woman's pregnancy will be. There's some women who really just enjoy being pregnant, and fortunately for me, that's pretty true. I love being pregnant, and I've never personally gotten to the point of feeling like I'm done. I can't go on. I want this baby out, but that's not the case for everyone. And certainly I have had my moments in my pregnancies too, but there's some people who just pregnancy is actually their biggest barrier to having children. And maybe they have one child, maybe they have two, maybe they would actually like more children, but they tell me, if I could just skip those 9 months of pregnancy and have the infant, I would be delighted. But for some people, pregnancy itself is such a challenge. And then we have things like, gestational diabetes that's happening and that women have to deal with throughout pregnancy. Rates of preterm labor in Edmonton are actually increasing, not dramatically, but they're not going down. So things like that are making pregnancy unpleasant for women and challenging and sometimes scary. Postpartum depression, all of these things. So yeah, absolutely. Preconception care is certainly about the child that will be born at the end of the pregnancy, but it's also about allowing women to enjoy their pregnancy, to feel better throughout their pregnancy, and to be honest, often those two things are correlated.
I was just going to ask you, is there a strong evidence-based correlation between a woman who is very healthy during their pregnancy and the health of the baby? Because I know some women who it was sickness, not just the first trimester, but throughout. And again, you're talking about the gestational diabetes. So is there evidence that a healthier pregnancy by mom, an easier pregnancy, leads to an overall healthier baby?
Yeah, so it's a great question. It's one that I have thoughts about, but science matters more than my thoughts. So when we talk about things like gestational diabetes, yeah, we know that can affect the health of the child. It can make for more complicated delivery, and there can be consequences of those things. I haven't seen science about things like nausea, vomiting, just general indicators of wellness throughout pregnancy and the offspring of children. So I think it would be a fascinating thing to look more into.
I guess with such a new area, the statistical accumulations are smaller. You don't have a lot of long-term evidence right now?
Absolutely.
Okay. Now, do couples come to you? It sort of begs the question to me. Now, preconception care, would you also be dealing with infertility and actually working with a couple to become pregnant? Yeah.
So it's really interesting. I'm always curious to know how patients come to me, how they found me, but also why they came, because there isn't necessarily this great feeling in society today that before you get pregnant, you should receive preconception care. And so the way the medical, world generally treats this is, if a woman has some kind of chronic disease, she'll be seen by a specialist before she conceives. If a woman is on a bunch of different pharmaceuticals, she'll be seen to try and optimize those medications so that it's safest for babies throughout pregnancy. So, and then certainly couples who are struggling with fertility are also seen, but it tends to be the people who have problems that are often seen by just the general medical establishment in pregnancy. To your question about, does this help women with infertility? I'm very grateful to have seen and worked with couples who had been trying sometimes for years unsuccessfully to conceive, and to their credit, worked very hard at implementing many of the things that we've talked about, and then were successful in conceiving and giving birth to children that were very healthy. 1 in 6 to 1 in 7 young couples today are being diagnosed with unexplained infertility. People who, started trying to have children expecting they would have no problems at all. And then after a year of trying, just have been unsuccessful and often much longer than that. And it can be a real challenge for couples because, again, they're given this label of unexplained infertility. There's no reason given, so they often aren't told what to do. Interestingly, I have an acquaintance who was given that diagnosis, and when she went to a fertility clinic and asked, what caused this, she was told, oh, it's all those chemicals. But then the flip side of that was, it's all those chemicals. Would you like to try IVF? And, it was interesting because my approach is often it is all those chemicals, but let's try and deal with those chemicals and see if we can get your body working properly. in order to allow you to have one or as many children as you'd like, and also actually to improve your health. So absolutely it applies to infertility. Over the last few years, I've been really grateful to have worked with lots of women with PCOS, women who again often have lower rates of fertility, have struggle conceiving or struggle to conceive, but also who struggle with a wide variety of symptoms. And some of the women I've seen, they're some of the hardest working patients I have. They've been trying so hard to get their symptoms under control. They've been trying all kinds of diets because weight gain is often associated with PCOS. They've been trying exercising and putting in all this effort, and sometimes just seeing no results at all. So they come in frustrated because they want to do the work, but they just haven't been successful in doing sort of the traditional the traditional ways of doing things. And they've been a really fun group of people to work with because, again, if they're willing to put in the work, we often see great advances in terms of resolving their symptoms, regulating their cycle without them having to be on the pill or anything, and then the ability to go on and conceive. So, the long answer to your question, but absolutely, there's an important space for this kind of work to be done with couples who are struggling with infertility, because frankly, sometimes the other options that they're offered just aren't palatable to them, and so this is one that most people can get behind.
Well, and herein lies the beauty of what you do, and again, back to something that listeners of the show hear all the time is root cause. If there's an issue, there's a cause, and if you can get to it by doing things that are natural, more holistic, working within yourself, as opposed to going straight away to IVF or things like that. Why not? And I think it's so important, and that's why you're given the space of this show to tell people that, there at least is this option, and give it a shot, because if it works once, it may work, throughout the rest of your life, that span of time that you want to have children. So very important. And when we get back from our break, what I want to start talking about, Dr. Genuis, is really the brass tacks of how you go about educating and what is involved in a protocol of preconception. So we will be back in a few minutes.
Sweet baby, on loan from above, no better treasure could I have more love. I stand here beside your bed as I pray. I lay my hand on your head and I say, may you grow up to serve him all of your days. May he lead you and guide you in all of your ways. May his hand bless your future with friendships that last. May you cherish your youth and not grow up too fast. I stare in wonder at your tiny frame, just to think that God knows you by name. He knows every hair on your beautiful head. He knows all your thoughts before they are said. May you grow up to serve
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Cathy Biase.
Welcome back, everybody. Today our show is taped, so no opportunity to call in. We are talking with Dr. Genuis about preconception care, a really fascinating area of study. And what I'd like to do, Dr. Genuis, is start off the second part by doing sort of a grand walkthrough of what you feel is an ideal protocol for preconception care. Maybe starting off with, when should women, young women, teenagers perhaps, start the thought process of taking care of themselves with the view on having a family?
Sure. From my point of view, the earlier the better. I'll sort of say, when I think about preconception care, it broadly is broken down into two areas. One is nutritional sufficiency, so ensuring that mom has an optimized nutritional status, not just for herself, but so that she has, in a sense, extra to be able to give to the developing fetus throughout pregnancy. So nutritional sufficiency is one area we pay a lot of attention to. And then chemical avoidance and sometimes elimination is the second area we pay a lot of attention to. So the chemical avoidance part is the piece that, the earlier people are thinking about this, the easier it will be for them. We talked a little bit about unexplained infertility and all the chemicals as a broad explanation of what's going on. And the problem is that some chemicals that we're exposed to will persist in our bodies. They're called persistent toxicants. And it just means that once they're in, they don't really have a very good way of getting out. And so if we have no idea about these things and we're just exposed throughout our life and not really paying attention, we hear this and hear that, but think, well, I feel okay, it's not really relevant, so we continue on, and then suddenly, in the few months before we have a baby, we think, I got to get rid of all these chemicals because they can pass on to my child. It's a much tougher slug than someone who's been aware of that most of their life and doesn't have nearly the same sort of chemical body burden as someone who doesn't know. So from that point of view, the earlier people are aware of these things, the better. And to be frank, again, this is going to lead to them having better health personally in their teenage years as well as in their later years too. So the earlier the better. But again, practically, or what's the time frame I normally see people in? My ideal is to see people a year before they conceive. Now, not everyone, again, is thinking that far out or planning that far out. Sometimes people come and, especially a couple struggling with infertility, they come and they want to conceive tomorrow. And we work with that. But it varies. 6 months, I find that sometimes it's within that period of time that people start thinking, sort of a 6-month time frame. And 6 months gives me a lot of time. A year gives us a bit more time to really make some of the changes, intervene a little bit if we need to, which I'm more cautious about if it's closer to the time of conception. But so I really like a year to work with couples before they conceive. But I've had people who said, I'm getting married in 6 months or 8 months, and we don't have immediate plans to conceive, but maybe we're just going to be open to it. So they come before they're even trying in any meaningful sense. Sometimes they actually, and it's funny, but sometimes these couples are helpful because they're putting together a wedding registry. And so being able to help them sort of craft the home environment, the kinds of things they're going to use in their kitchen and in their bedrooms and so on and so forth, can actually also be a good place for eliminating exposures and things. So there's never anyone who has come too early. And certainly there have been people who have thought, I wish that we could delay things a bit longer so we could do a little bit more. And then I've seen outcomes and thought, this person really could have used a bit more intervention. But But I work with anyone wherever they are, and we kind of go from there. I have some patients who say, this is what we're thinking, but what do you think? And what do you think would be sort of the best time frame for us? And then we kind of work that way. Obviously, I'm not in the business of telling couples when to have children, but always happy to sort of provide medical advice in that regard.
That was a very interesting thing you said about the bridal registries and creating a healthy home environment. That's an interesting angle. Very interesting.
Yeah.
I just so hope this is getting out to the right ears, because it's so very important. Now, are you talking detoxification? That's something that you don't often hear from a medical doctor. So is detoxification something that you take people through the process of? And if so, what is your detoxification protocol?
Right. I think the word detoxification has come to mean a million things, and those things range on the spectrum from completely ridiculous to very scientific. So sometimes I wish I could just give what I did a different name, because I certainly make every effort to ensure that the stuff that I'm putting forth to patients, that I'm suggesting to patients, is only things that we have solid scientific evidence for doing. That being said, absolutely. There's no question that chemicals are being transferred from mom to baby throughout pregnancy. We live in a world that's full of chemicals. A few years ago, the Environmental Working Group did what are called cord blood studies. So when a newborn baby was born, they sampled blood from the baby's umbilical cord. So the baby hadn't even breathed really the hospital air. They'd had nothing put on their skin. They hadn't breastfed, nothing. They had just been in the womb. They'd just been delivered, and they sampled the blood that came from their umbilical cord. And in the 10 infants that were sampled, there were 287 chemicals found. So, that's not a small number of chemicals. And they're not inert chemicals. Of them, many of them were known, or at least strongly associated with things like cancer, with things like brain and nervous system toxicity, or different birth defects, or reproductive defects. So, this led to, there was one sort of commentator who was writing about this article who said our children are being born pre-polluted. And based on, again, this science, I think that's in some ways a fair statement. So is detoxification necessary? Yeah, I think it is. And there's many approaches that people will take to this. There's some general detoxification measures that I do think it makes sense for couples to engage in, and that I'll talk with them about. But again, I sort of mentioned this earlier. I won't do anything if they're planning to conceive just any time, or if they say I'm planning to conceive in the next 2 or 3 months, then I will suggest that they avoid detox of all sorts. This is the reason. In those 3 months before conception, that's when new sperm are growing and developing that will be the ones released 3 months later. And so that may be the sperm that will fertilize the egg that will go on to create the child. And so so in that time frame, I won't suggest that people do anything that involves detox, because often anything that involves detoxification will actually mobilize chemicals that sometimes have been stored away. And so if you're flooding your bloodstream with chemicals during a time frame when new sperm are formed, you can actually affect, it's very plausible that you will affect the health of that sperm. So if I have longer than that, if patients see me 6 months or 9 months before they plan to conceive, then we'll talk about some general detoxification methods. So some of them, and the thing about general ones that are nice is that there really isn't harm to them, and they're broad spectrum, so they will help to eliminate all kinds of things from a person's body. So some of those things, exercise is really important for detoxification. We often think of it in terms of cardiovascular health, which absolutely, but there's other things that happen when you exercise. One of them, there's a researcher who looked at the contents of a person's breath when they were exercising versus when they were at rest. And it was found that when they're exercising, they're actually exhaling some toxicants, some different chemicals that have accumulated in their body that they're not exhaling when they're at rest. So just getting your respiratory rate up is actually helping you to detoxify and things. Sweating, we know, is a very broad spectrum way to dump chemicals. There's been very credible papers published showing that that numerous things come out when a person sweats. Heavy metals, different kinds of chemicals will pour out of a person's body. Well, some of them trickle out, some of them pour out. It depends on the chemical, but they'll come out when a person sweats too. So some people will use saunas, some people will use hot baths, some people do hot yoga, whatever it is to just get their body sweating. Can be an effective way of detoxifying as well, or lowering a person's body burden of chemicals. Certain supplements can be used to support the body's natural detoxification mechanism. So we'll talk about that, but often the detox, if there's anything beyond that we're doing, it really depends on the person in front of me and the kinds of exposures and levels that they've had in the past.
So is there an ideal diet that you would have? Like, is there a detox diet, or do you just hit diet in a general sense? What do you recommend as far as nutrition for preconception care?
As well as I do, that the world of, or the number of perfect diets that are being advocated today is endless. There's it can be a hard world for people to navigate, trying to figure out what's the healthiest way to eat. Sometimes, again, this will be quite customized to the person in front of me, but the general guidelines, if you will, that I give my patients is just to eat a traditional whole foods-based diet. There's been a lot of changes recently in the way farming's done. Our soil is when it's analyzed now compared to soil that was analyzed in the 60s and 70s, we see that there's been clear declines in the level of different nutrients that we find in the soil. And if it's not in the soil, it's not in the food. So we're seeing nutritional deficiencies accumulate because of changes and shifts in farming practices. So, I encourage patients to eat as much as they can, just in terms of whole foods, things that came from the earth and not from the factory. Often I talk to patients about doing a Whole 30, which is sort of this new trendy diet, if you will, that's out. It's 30 days of eating pretty much only whole foods, eliminating the large majority of foods that some people will find that they are intolerant to. And I like it because it's so popular right now. There's really a lot of resources. There's a lot of online support. There's people who will provide, meal plans for the 30 days and grocery lists and all of that. So, and the other thing is that I just find that most people, if they say, okay, I only have to do this for 30 days, they can get through almost anything. And then, I tell them from the beginning, this isn't just a 30-day thing. It's just a way to sort of get you into eating more whole foods, higher nutrient density in the foods, and things like that, to try and make up for sometimes what are presumed nutritional deficiencies, but sometimes things that we can demonstrate. But certainly there have been population-wide studies looking at, what's the average person's intake of magnesium, and the majority of people aren't meeting what sort of recommended dietary intake suggestions would be. There have been population-wide studies of things like vitamin D in Alberta, but this obviously applies to much of Canada. A lot of people are deficient there. So working with all kinds of things, but dietary-based to try and ensure nutritional sufficiency, I think is really important. And I do encourage patients in the time prior to pregnancy and throughout their pregnancy, and as much as they can, to eat foods that are free of pesticides, whether that's from their own garden, whether it's from a local farmer that they've gotten to know, and whether it's certified organic stuff. We know that pesticide levels in a person's body will change based on the amount of pesticides on the foods that they're consuming. There have been really interesting children's studies looking at that that seem easily extractable to adults. And then the associations between pesticide exposure and health outcomes in children are the evidence is really adding up right now to a point where I think that as much as pesticide avoidance is possible, it's something that people should strive from. So I point them to things like the environmental working groups Clean 15 and Dirty Dozen as sometimes as starting points. I encourage them actually to start with animal products when they're going organic as a first step, because that's where the potential for contamination and accumulation is perhaps the highest. So all of those things I think are an important part of diet. And the last thing I'll just say quickly on that front is I've been talking more and more with patients about preparing properly fermented, so anaerobically fermented foods, because I think our microbiome, our germ environment is so important to take care of and to tend to, and more research that really, to me, is fascinating is coming out about the importance of the germ environment for having a healthy pregnancy and having healthy children.
And just to be clear, we did not speak about you saying this before the show, right? Because this is something that I preach all the time. So, they're going to say, oh, she prepped her for that. But no, not at all. This was totally your own thought process, and it's amazing. Now, to that, what I want to get to just before we have to start closing out the show, more and more scheduling of deliveries to work into people's busy lives. And what is missing? What is missing, and what I would like you to cover, or if you find it's an issue at all, when when a baby is delivered from C-section versus a vaginal delivery, what is missing when the baby is taken from mom that way? Yeah.
So, I mean, obviously this connects perfectly to stuff, my comments on the microbiome. For a long time, I don't think we knew what's the difference in a child that's born vaginally versus through a cesarean section. But again, recent research techniques and also just greater awareness of the importance of germs has led to the recognition that the journey that an infant normally takes down the vaginal canal is, in a sense, the seeding of their GI tract, because they are swallowing all kinds of mom's germs as they come down, and those germs then begin colonizing their GI tract, which before that point is probably sterile. There's some interesting new stuff saying maybe there's some exposure beforehand, but at least up until now we've thought was sterile, and certainly even if it's not, this is a huge contributor in terms of forming the germs that will colonize their gut. And it's really interesting. If you look at the germ environment of an infant who's, a couple months out from being born, 3-6 months out, you can actually look at their germ environment and predict with very high accuracy, I should say, how they were delivered, whether they were delivered vaginally or through cesarean section. Because those that are born vaginally will have a germ environment more similar to the germs that they were exposed to in the vaginal canal, which has been thought to be the healthier types of germs to have to promote lifelong health, versus an infant born through cesarean section will have more sort of skin types of germs, because that's what they would have been exposed to first. And to that point, there's some really interesting research being done. There's a study that's underway right now. It just started in July of this year, so it'll be a few years before we have results. But they've enrolled 800 participants. There were smaller studies done originally, and it just wasn't enough to reach any meaningful conclusions. So this is the larger scale one. 800 women who are going to have a C-section, so planned for some reason. And what they'll do, I think, with half of the group, is they're going to take sterile saline-soaked gauze, and they'll place it in the vagina of the mother before she delivers. And then quickly after the child is born, that piece of gauze will be wiped all over the baby, on their skin and their mouth and their hands and their feet. And, it sounds a bit strange when you say it, but the goal is just to mimic that journey down the birth canal that they otherwise will have missed. And so it will be really interesting to see what that does. Again, in the smaller scale study, and it really was like 4 or 5 women that this was done on, but they did find that there are meaningful changes in the infant's microbiome, and that was, I think, a month or two after delivery. So we have encouraging early results that this could make a big difference, because, obviously C-sections, sometimes they're necessary. It's not something that can always be avoided. And so the question is, can you replicate the journey down the birth canal that otherwise infants would have, in order to try and stave off some of the side effects that are associated with not having that journey? Just quickly, the American Academy of Pediatrics a couple of years ago released a paper that was really warning doctors about this sort of climbing rate of C-sections, because it's been associated with the risk of all kinds of chronic immune disorders, things like asthma, juvenile arthritis, inflammatory bowel disease, leukemia, and so on. So with C-sections being one in 3 or 1 in 4 pregnancies, the endpoint of them these days is something that the medical community is starting to pay more attention to how we can eliminate that.
Fascinating
or
information.
decrease it, not eliminate.
Yeah, it really is fascinating. And again, we always harken back to the body and its natural processes. And even though we may not understand everything, there is a reason that our bodies are geared to doing things the way they are. And of course, there are some situations where C-sections. I had one of my 4 children was C-section. So it's not a shot against moms. It's just more information to help you if that situation arises. So we're pushing right up against the end of the show, and I want you to, if possible, give a couple of tips for people who may be, thinking about this now. And before we do, I just want to give your website. It's preconceptioncare.ca if you would like to learn more about Dr. Rebecca Genuis. So let's end off the show with maybe a couple of tips that you think are very important.
Sure. So perhaps just if we talk about those 2 areas, the first one would be nutritional status. Maximizing nutritional status is so important. Nutrients, whether minerals, vitamins, trace elements, all of these things, they're the building blocks for our children's health and for their body development, their brain development, and everything in the womb. So really doing your best, both the husband and the wife, to maximize nutritional status, primarily through whole foods, pesticide-free foods. I think it can't be underscored. Taking a clean prenatal vitamin and folate, I think, are both important, and the research certainly suggests and backs that up. And then the second thing would be chemical avoidance. These things are found in sometimes, again, on the food we eat. They're found in the products we use. They're found in the air we breathe, and so on and so forth. So I would be looking for opportunities to really clean up a person's environment in terms of the chemicals they're exposed to. There's been really good research on women exposed to renovations just throughout pregnancy. Oftentimes, there's so much excitement about a baby coming, about preparing a nursery. There's painting and all of these things happening, but some of the chemicals that come off of paint have been associated with problems, and just renovations in general have. So looking for where chemicals may be present in your life, cleaning that stuff up before you conceive, before a woman conceives, and also staying away from that as much as she can throughout pregnancy are things that I think can really make a big difference.
Thank you very much. I really appreciate it. It's been a great show. Thank you for your time, Dr. Genuis. And everybody, we will talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by